All right, my presentation is from the book The Center Cannot Hold My Journey Through Madness by Eileen Sachs. So this is Eileen Sachs, and she was diagnosed with schizophrenia, and her book was pretty much a memoir talking about um from like the time she was a child to her late adulthood, just about her journey with schizophrenia. So schizophrenia has four phases, and she had gone through each of these phases, and she discussed them in her book. So the first phase is the pre-morbid, and in high school, she recalled seeing the houses on her walk talk to her, and she just had some early warning signs that something was wrong. Then her prodromal phase was during her early years of college, and she had some behaviors where she wasn't eating, she wasn't practicing personal hygiene, and had some strange behaviors, which we will get into. And then during her active phase, kind of started around the end of her undergrad and into graduate school and then her early adult life, she displayed lots of different psychotic symptoms, especially when she was without medication. And then there's the residual phase, which I'm assuming is the phase she's in right now. And she didn't really discuss it a lot in her memoir, but um, she did kind of talk about like the symptoms being less severe than they used to be. So here are the DSM-5 schizophrenia symptoms. People have to have two of the following five for over a month, with lasting 6 or more months. So false beliefs or delusions, false perceptual experiences or hallucinations, hard to understand speech, loss of train of thought, symptoms only loosely connected to meaning, unusual behavior, which can show up in different ways, from silly and childlike to angry and aggressive, and inappropriate moods, or catonic behavior in which the individual is unresponsive to external stimuli, with disturbances in movement from immobility to excessive activity. And then there's also negative symptoms, which is a decrease or absence of normal functions such as social withdrawal, sloppiness of dress and hygiene, and loss of emotion, motivation, or judgment. Now, the symptoms that she exhibited, that she talked about throughout her memoir, was she definitely had a lot of false beliefs. She had like somatic delusions where she believed she was sick, and some delusions of persecution where she believed people were constantly out to kill her, or hurt or kill people who were important to her. She did specify in her memoir that she very rarely had hallucinations, just like every once in a while, but it was not like a frequent thing. But she definitely had the hard to understand speech, like this disorganized thought process, seeing through different forms of disorganized speech. Um, Especially she had derailment, cognitive slippage, listening associations, and clang associations. So I just took an excerpt from her book, which shows this hard to understand speech, where she said, she was talking to her therapist and she said, headaches, aching heads, maybe another bleed, blood simple, ha ha ha. Laughter occurs behind the scenes. I'll take the scenic route, where it doesn't really make sense and can't really, it's not really an organized set of sentences. She also had some unusual behavior. She was talking about an evening when she was in her undergrad and she was like was hanging out with her roommate and her like boyfriend at the time, and she just like started telling them to ask her to do random things. And it like started out pretty like chill, like said quack like a duck, and then it like got into more serious things um like she started being like, oh, ask me to take my shirt off, ask me to swallow a whole bottle of aspirin, and they weren't really laughing at this point. She just did them anyways, then had to go to the hospital. Then she definitely had negative symptoms. Also like she talked about this like in her early grad, like where she would forget to practice like personal hygiene, she would forget to eat. And then she also had this alogia, which she was described by her interviews and colleagues as being practically catatonic during different situations. Like she mentioned this happening when she was like in job interviews or in like she works at USC as a law professor, and when they were doing like workshops, like the professors, one of them came up and told her that she was catatonic throughout the whole workshop. Now, she went through different treatments in her memoir, but for a long time, they were not able to diagnose her and didn't diagnose her with schizophrenia, which I think is due to the fact that this was happening like years ago. It seemed like before schizophrenia was a more like mainstream concept, but once they kind of figure out what was going on, the treatment considerations I would have prescribed was she had different antipsychotic medications that worked with varying levels of success. And I would recommend that she prescribed on these medications, preferably the last one she was on, which is clozapine. It worked the best for her. So you talked about the one that she was on before because she started having like breakthrough symptoms, but she seemed like at by the end of her memoir that this was the clozapine was the one for her. It worked the best. And then she also participated in a form of talk therapy throughout her memoir called psychoanalysis. And this was pretty much a lifeline for her. She was doing this even when she wasn't medicated, and it was able to keep her in school and like functioning. And I would definitely recommend that she keep this up. Um, and continue doing the talk therapy and the medication. And then if I had been her doctor when she was in college, like her early grad, I would have recommended her and her family participate in family therapy because there was some like her family didn't completely understand what was going on, and the schizophrenia was kind of a newer idea at this time, so it was valid, but I think it would have really helped them maintain a really good relationship if they had been in therapy. So while reading it, I wasn't able to like document like her ideology. But there was some mental illness in the family. She said her uncle was depressed, but she didn't mention anybody else in her family having schizophrenia. She didn't talk about any early physical trauma or neurodevelopmental factors. So kind of only things left was like her brain structure and function must have been a part of it. And then this is not directly related to why she had schizophrenia, but like mentioned before, her parents had directed high levels of express emotion towards her. So it seemed like some of her relapses might have came from this being a part of it, just like the added stress. As for like my reflection on this, Emma really opened up my eyes to the reality of schizophrenia. Um, Aline is a super successful human being. She has so many degrees. She speaks so many different languages. She was like an amazing student, an amazing professor, just like knew a lot about, she was super smart. And that's not what you hear about when you hear people talk about like people's schizophrenia. And she did note like in her memoir that she is not trying to say that this is what everyone with schizophrenia should be striving for. This is what everyone with schizophrenia like can do. She does recognize that like she's like a standout case, but it was really interesting to hear just like a different perspective than what you normally hear in the media about schizophrenia. Um, and also another thing she brought up a few times throughout her book was that people in her life would have this like idea that people with schizophrenia were violent by nature and were violent human beings. And she like talked about how, or just people with mental illness in general, she talked about how this wasn't the case and there weren't like any proof that people with mental illness were more violent than people without just because of the mental illness. Um, so it was interesting, like I feel like a lot of times in media you also hear about people with schizophrenia being violent, and she never was, so I thought that was an interesting part. Um, yeah, so that was kind of my reflection on it. It was super interesting memoir. Her life was incredible, and I was really happy that I read it. And then this is another um except I took from her book, um, where I think it really just kind of showed like how she understands her illness. But explaining what I've come to call this organization is a different challenge altogether. Consciousness gradually loses its coherence. One center gives way. The center cannot hold. The me becomes a haze, and the solid center from which one experiences reality breaks up like a bad radio signal. Which I think was just a really great way of explaining how schizophrenia affected her and how she rationalizes it in her brain. And yeah, that is my presentation.